Hi, and welcome to the under 5 minute explanations. Although today's session only goes for just over 3 minutes. I'm Nurse Tanya, and today I'm going to talk to you about what is cellulitis. Cellu meaning a small cell, and itis meaning inflammation. So, what is cellulitis? Well, cellulitis is a common, potentially serious skin infection. The infected skin appears swollen and red and is typically painful and warm to touch. It most often affects the skin of the lower legs, although the infection can occur anywhere on your body or face. So, to understand cellulitis, I want to explain the anatomy of the skin. This side profile of this is a cutout from your skin. This is the epidermis layer, the dermis layer, and the subcutaneous tissue. Cellulitis specifically affects the dermis and the subcutaneous fat. Sometimes muscles will be involved. So now you know what cellulitis is and what it affects. But how does it happen? Well, any cut, puncture, burn, or bite, basically any break through the skin's protective layer that can allow the bacteria to enter. This break can be so small that you didn't know it was there, but the bacteria can still find it. Okay, so what sort of bacteria am I talking about? Well, the most common bacteria is Streptococcus and Staphylococcus, although a methicillin-resistant Staphylococcus aureus, also known as MRSA, is increasing. So there are other conditions that can mimic cellulitis, and this is why going to your doctor is important. Common mimickers include a venous thrombosis, which is also called a DVT, dermatitis, lymphedema, gout, or contact dermatitis. So, what are the signs and symptoms of cellulitis? Things that you need to watch out for are redness of the skin, warmth, swelling, tenderness or pain in an area of skin, weeping or leaking yellow, clear fluid or pus, a fever, red spots, blisters, and your skin might dimple. So, how do you prevent getting cellulitis? Well, some people are more prone to cellulitis. If you've had cellulitis before, you're more likely to get it again. You need to be more careful. People with lymphedema or low immunity. So, good hygiene is a good place to start, keeping the skin clean, dry, and well moisturized, preventing the skin from cracking and letting bacteria enter. Treat any wounds immediately, clean the area, and cover with a band aid to stop that bacteria again. Always wear long pants, sleeves while gardening, and wear compression garments if you're required to wear them. This does several things. It prevents anything from scratching your legs or your arms, but it also pushes all that lymphatic fluid away. And if you listen to my lymphedema YouTube clip, you'll know that the lymphatic fluid is a good place to harbour these infections. So, how do you treat cellulitis? Well, first step is to go and see your doctor. A course of antibiotics and good wound hygiene will usually fix cellulitis within a few days. But if you've had no response to these antibiotics, a fever, or your signs and symptoms have become worse, you may need a trip to a hospital for antibiotics via your vein. So, just a basic overview, cellulitis is an infection of the skin. You need to see a doctor for antibiotics, and you need to keep the area clean. So I'd like to say thanks for watching from Mind, Body, Soul Nursing, Holistic Solutions Australia.